Thank you, everyone. As Steve said, my name's Suzanne, just to introduce everyone again. And this is Jarina, our consumer rep here. And we've brought along a token executive today, which is Let's. So he's here just to look pretty, but he will say a few things. So as you can see, is it okay if I stand here? I tend to move when I'm talking. So as you can see, our presentation today is on culture change and specifically looking at the role of individuals, but also individuals working as a collective. And we've got this image here talking about driving culture change needs multiple hands on the wheel. The way we look at it, it is not up to Lance, it's not up to a consumer, it's not up to one person who has that portfolio to do that work. It has to be a collective, and we all have to be going the same direction, and we have to work together to make it work. So I'm going to take you on a bit of a journey today, because we're talking about many hands on the wheels. We're talking about a little bit of a car journey. So I'm going to take you through the journey of our culture change. So my background, I'm not a clinician. I'm also not a change person. I'm not a culture person. But there's one, and I know we use a lot of acronyms in health, but there was one acronym I came across when looking at culture change that I actually really liked, and it was ABC. And it basically says, as you can see, attitude plus behaviour equals culture. And I suppose that's what I've kept in mind as we've put these programs in place to, it's not just about what we do, it's the way we go about things, it's what we believe, it's what we say in every single interaction, it's the way we operate that will, have a cultural, impact the culture at the end of the day. So, just going to take us back a few years, and I'm going to ask Jarina now just to share her experience of what it was like to be a consumer. She's been involved with our organisation as a patient 15 plus years, and she is an active consumer in the breast cancer network, and so had been actively trying to get involved, in Metro North and more specifically Caboolture Hospital. And I'm just going to let her share what that experience was like before we sort of kick-started things.
Actually, Suzanne, it's closer to 20 years because my introduction to Queensland Health and Caboolture Hospital was in December 1997 when I was diagnosed with breast cancer. So I'm coming up to my 20th anniversary. So I'm a thriver, not a survivor, okay, just to get that right. So things were very different back 20 years ago, and I was very unhappy with a lot of the things that happened to me in my first experience of hospital. But I had two very caring and compassionate registrars and a very thoughtful nurse who managed to sort of keep me on a level of sanity that was quite handy because I was falling apart. But since that time, and because of my experiences, I've been actively involved with supporting cancer patients and with advocating for change in our local hospitals, particularly when our little hospitals don't have the same standard of care that other hospitals in our health district do have. That just irritates me. But my efforts were generally ignored, and it was like fighting uphill all the time. You were knocking on doors where nobody was home but the lights were on, and you were looking for windows of opportunity and there was just blank walls of indifference. So it was really frustrating. I wrote countless letters and emails about various services that we needed, and most of the letters were never answered. So it was just really frustrating. And the thing was, what made it harder and more frustrating was I wasn't acting alone. I was writing on behalf of my support group with over 400 members. And I was supported by a lot of well-known and important community groups. There was Zonta, there was Business and Professional Women's Association, Dragons Abreast, some weight class groups, the sports club. And so why was I being ignored? This is not just my issues. This was community issues. So I just didn't understand it. And that was advocacy over the last lots of years. Thank you.
All right, thank you, Jarina. And Jarina will talk again throughout the presentation as well and share her journey throughout it. But I'm just going to ask Lance now just to share a few words, because Lance and I both came in, Lance a few years ago and myself a couple of years ago into the organisation. So I'm just going to get, from the executive's point of view, what he thought about where we were at.
The standard of care was not uniform. that some parts of the organisation had it right and other parts did not. You could not say with confidence or conviction that the expectation was of person-centred care. There was a willingness to consider and to explore change, but by and large people were stuck about how to actually do that. None of us are particularly happy about the way it is now. How do we move it forward? So there was good intent, there were pockets of good practice, but it was an organisation that was stuck. So we had to shake it up.
Absolutely, thanks Lance. And I do want to highlight, I know Lance just said about pockets, we had some brilliant projects happening at the time. One of those ones is one you can see outside with one of the learning pods with the maternity, e-maternity site. You know, we had areas that were doing great work and really trying to drive things forward, but we didn't have a uniform approach. We didn't have an overarching commitment. But then we found out, or I suppose we knew it was coming, Caboolture's a really burgeoning area. We're about to grow the population by about 40% in the next 5 to 10 years. That's an extra 60 to 80,000 people accessing our services. And we have a very low socioeconomic area with a lot of psychosocial issues, you know, high poverty. I think we've got, you know, twice as many young mothers under 20 than the national average. So there's a lot going on. And we knew we weren't quite hitting the mark as far as patient-centred care. And we knew that if we were going to grow to be the hospital that the community needed in the future, that we really needed to work with them and we needed to understand what they wanted from us. So that's where we had a jump start, kind of what kicked us off. We said, right, we've got something we need to do now. So that started the journey back in 2014, 2015. Now, to start with, we went, okay, well, we actually need to start talking to our community. We've spoken with individuals. We need to actually know what the community says. So we held a workshop. And we invited people from the local community to come and talk to us about what we had, you know, basically their experience of service and what they envisioned us being in the future. Now, interestingly, the people who were invited to that workshop were people who had made complaints against the hospital. So we invited them in. We had very strong supports in place. We had, you know, the staff were trained up. We had social workers, psychologists, people there to allow people to share their experience. For them to be, you know, to do that in a safe space, but then to have, you know, facilitators who then worked with us, with them, to guide a conversation so that they walked out thinking that they had, you know, that what they had said had made a difference and that it would make a difference in the future. We did a lot of dreaming and, you know, discovery planning about where do we want to go? Give us the idea of what you want to see. So around that time, you know, we had these workshops with them. We did staff workshops as well. And we got lots of awesome ideas from them. And around that time, there was these words that were being thrown around. You know, we were talking about, well, how are we going to do this? And I think it was actually one of our consumers who said, you know, this is not about, you know, us telling you what to do, and it's not about you telling us what to do. It's just about us doing it together. And this idea of caring together was born. So this is actually the second iteration of our Caring Together initiative or program. When we first started, it was mostly around patient and family-centred care, and we would say that, you know, Caring Together is our commitment to partner with you so you feel heard, valued, supported and respected always. And that's the values we had in the way that we approached our patient and family-centred care initiatives and consumer engagement. And this is one, you know, this has moved beyond in the last year or so. It's moved beyond being a program to just business as usual. So Caboolture Hospital is now improving the health of our community by caring together. So after all those workshops, staff workshops, community workshops, we went, okay, we know what we want. We want to go from where we are now, we want to be the most patient and family-centred hospitals in the country. We also realised in talking with our staff that to do that, we had to be an employer of choice. We had to take care of our staff so well that they were so happy that they then took care of our patients, because we knew that. And we heard that from consumers as well. They said, take care of your staff, then they'll take care of us. So we said, okay. So then we knew the destination. We knew where we wanted to be. And we went, okay, well, how do we get there? And we'd had a bit of a conversation with the Australian Institute of Patient and Family Centred Care. And so we went to them. We said, hey, do you guys have a framework or a structure we can use? Because we want to do this. How do we get there? They said, we don't have anything. We don't have anything we can give you that will detail, a step-by-step process of how you can get there. So we said, okay, well, can we develop one with you? They said, sure. We said, we'll do all the work. They said, sure. So over the last couple of years, that's been a project that we've had ongoing on the side. I shouldn't say on the side. This has kind of been what's driving a lot of our work. We have developed up our Caring Together framework for patient and family-centred care. And you can see in the diagram on the left, just in case you can't read it because I know it's a little bit blurry, we have the basically the Caring Together values around the outside. And then we've identified 6 key areas that need to be influenced in order to deliver patient and family-centred care. Learning, leadership, service delivery, engagement, service improvement, and the environment. We kind of had that as a broad idea, and then we actually have done a lot of work, literature reviews and things, and took feedback from our consumers. And you'll see on the left, your right, we've actually developed that out into a framework. So now when we say, well, of course we need strong leadership to deliver patient family centred care. Well, what does that mean? And we have a whole list of things then that means. That's what we're aiming for then. And we're slowly kind of finalising that and getting that ready to share it with people. But look, at the end of the day, this is just a piece of paper. That's a piece of paper, and the idea is that we'll get to a point where we can share that with other people. But, we wanted to make this real. We wanted to see if this is something that we could actually do. So over the last couple of years, we've been just doing a lot of work about embedding this framework, testing it, seeing if this is what would actually work. And what we've done, the process that we've taken is that we have a Caring Together governance committee. So we have a committee within the hospital that has everyone from executive down to so we've got all doctors, nurses, operations staff, admin people, anyone who's really keen to be involved. And Doreen is actually our consumer who sits on that committee. We also have a consumer network. Now I know a lot of people have consumer networks. We went about ours a little bit differently. We set up the consumer network so that when consumers are recruited or found or brought into the organisation, they are brought into the network. And the network meets once a month as a group, and the idea is that then our consumers get to network. They get to learn from each other. We have about a dozen people who are on that, and they are kind of integral. So they come into the network, and then based on their interests and experience, we then link them up with a committee or a working group or another project where they say, hey, I'm interested in that. But we also say, what are your interests? What's your experience? What would you like to get involved with? And then we find projects that align with those desires. We have made sure that the network has a clear, up influence. We make sure that what they're doing is not tokenistic. That they're not there just to help us. It's a big part of what we do within the network is educating the consumers as well. And I will say that one of the most valuable parts of this is constantly having that executive support. We've had executive come and talk to the network. We have people from across the organisation come in and talk to them. I just want to highlight, I've highlighted there, it is about a partnership. We treat, the way we approach it is that, consumers are the experts in their lived experience, and we try and make it very much two-way. Of course, we'll have things that we ask of them, but we say, what do you want from us? How can we support you? And you can see we get involved in lots of activities. And so basically, I suppose I'll just touch on the way that we do it is at each network meeting, we have about the first half where we have a guest speaker who comes along and educates the consumers on a particular topic. And then we spend the second half doing a bit of a workshop on a project that's happening within the hospital. All of our major committees and working groups, we are a fairly small hospital, but we've managed to integrate people into most. And we'll find now that most people will say, hey, like we're starting this group, we've got a working group, can you get us a consumer for this group? If we don't have one within the network, we'll certainly reach out and find others. And we found this is a hugely valuable experience for our consumers, but also for our staff. Simply having someone sit at the table, be that present, be that body, so that when we're talking about budgets and we're talking about infrastructure, the next person, in line is the consumer. What are we doing? How is this going to impact our patients? And one wonderful thing that happened last year, we had our Deputy Director of Medical Services who sits under Lance, and he said, from now on, we want a consumer on every interview panel for every senior appointment within the hospital. So we've managed to achieve that over the last 12 months, and it's been a phenomenal experience. Not only for consumers who they think a lot of them felt very fish out of water. What are we going to who am I to sit on the interview panel for a senior staff surgeon? And we say to them, you're in there not to look at their their experience, but just purely to think, would you want this person to be your doctor? Would you want them to be your nurse? Yeah, sorry, jump in, Lance.
Yeah. My observation is that clinical staff can be beguiled by the CV. You can have an impressive CV from an eminent person, but it's the consumer representative on the panel who's more likely to out the dickhead, the one you don't want in the organisation.
Absolutely, and I will say that has happened on more than one occasion. We've had panels of senior leaders who will be, they'll say, oh, what about this person, what about this person, and they'll turn to the consumer and say, what do you think? And they'll say, well, they didn't really answer that question, or they didn't really, I felt really uncomfortable with the way that they were talking about their patient, and then the staff will say, oh, yeah, I didn't get that. Right, no, you're absolutely right. And, it's been integral for them actually coming up with, their list of, what do you call it, the 1, 2, 3, the short listing of who's going to actually be recruited. And it has been a phenomenal experience because now we're getting the right people. That's what, driving the culture, getting the right attitude, getting the right behaviour is about getting the right people. And that's one way that we've been doing that we found really works well. So, like I said, for us, building partnerships is really about integrating, getting people out and into every opportunity that we have. We have our consumers are building relationships with people. We have people aligned to ED or people aligned to outpatients. We have people who are our spokespeople within the community on our Caboolture Healthcare Alliance. We have, our little, she is little, she's about this big, she's gorgeous, Lenny. And she goes around every Thursday and she just does patient surveys because she said, I just like talking to people. So she goes out and she is loved by our staff now. When they see her coming, they welcome her into the ward and they say, Lenny, just don't go into that one, you might, catch the flu, but otherwise go and talk. And we'd love to hear what people have said at the end of the day. And she's now, one of our most desired people around the hospital. One of our big projects that we did was the Ward 3B, which for anyone who was here last year, Christine Bryden shared her experience of being a consumer on that. That was a co-design project. We actually have built a ward with an 8-bed secure unit for people with dementia and delirium, and Christine is a person living with dementia. And she had some brilliant ideas and experiences she was able to share during that design phase, and things that dramatically changed the design of the ward. So you can see that one of the key things that she wanted was the contrasting colours within the toilet, and when she finally saw it, she actually was almost teary. She speaks about dementia all around the world, and she said, this new ward that you've got now, this is world leading. And it's really encouraging for us and for the patients and the families that we have coming in now, knowing that this has been designed with them in mind because we had a consumer who was involved. So one of our big areas of focus around driving culture change is education. And I know it's a big deal for a lot of people. We always talk about get consumers involved in education. We've taken a bit of a different approach. Of course, we talk about consumer engagement, patient-centred care, and orientation, things like that. But within the framework that we've developed, we use the words immersing staff in consumer perspectives. So instead of having one course on consumer engagement, patient-centred care, we look at the year-long program for education and we identify which of those educations that's happening can we get consumers in, get that voice into the ones that are already planned. So you can see obviously new doctor orientation. We did 1 hour talking about lived experience around handover. For example, I'll just show one of the ones we did was just this one down the bottom here. That was one that I saw on the calendar. I went, okay, well there was already a doctor who was prepared to talk to our interns about treating people with depression and anxiety. And I said, well, we have a couple of consumers who've got the lived experience. Can they come along as well? And we ended up talking with the doctor ahead of time, and it was brilliant. It went from her sitting there telling them what to do and what they should be looking for, to having a very open conversation between the consumers and the new interns about their experience. This is what I'd want from a doctor. This is what I'd hope you look for. And it was hugely valuable. And now we have them, like I said, building that value, as the consumer network, and really, getting those people involved. We have people coming to us now saying, hey, we've got this coming up. Who have you got? Who can we get involved? And it's now rather than pushing people onto our staff all the time, we've got them coming and saying, hey, how can we get them involved? I will just touch on very quickly, like I said, part of this whole program has been about, getting our staff engaged as well, and getting them involved in patient family-centred care and helping them make it relevant for them and finding the value in it. So, there's a couple of the projects we did last year, the Tribal Challenge and also Kindness in July. And that was just helping people to think about, how do they connect with their patients? What else could they do in their local areas? And we've had some really awesome projects come out of that, including the one down here. We've designed a whole new handover document from ED to the wards, and that's been included, with patient involvement, because they identified that. We went, how are you doing patient family-centred care? Where are your gaps? What could you do? Let's do a project around that. And they've been able to do that. So I might just hand over to Jarina now. I've talked from our point of view, being the person on the ground, the staff member doing this day to day. I'm going to hand it over to Jarina just to share her experience of what it's been like to go through that change process with us.
Well, I must say, along came Suzanne. And so this little powerhouse of enthusiasm and determination just swept us all along in her wake. It was really easy. We didn't have to worry too much about anything. She sorted everything. So, but her focus initially seemed to be entirely on creating these meaningful partnerships between staff at all levels and the consumers, which was, and we all felt that. And we all felt that she needed us to be real partners and not just tick a box. And that was really important for a lot of us who'd been sort of battling to get into the system for a long time. So things have changed, and the difference at Caboolture Hospital is actually palpable. The hospital is now, in just over 1 year, I might say, she's done all this in a year. In just over a year, this hospital is now a truly friendly place, a place where you feel welcome. So she stole my thunder, but I was going to tell you some of the things we do. But for example, the whole face of the hospital changed because we reviewed some forms, documents, signage, posters, and the hospital just looks different with all these new posters and nicer colours and neater arrangements and things like that. So you didn't get that one. But yeah, we suggest changes in building design and policies, and also review some education stuff. So staff surveys, yeah. And so really, and also we've had people speaking at the all-staff forums as well. So new ideas and new projects just keep on emerging. So we're not losing any interest at all. We're actually getting quite excited about it. We're also reviewing consumer complaints and learning about what sort of complaints come in and then how they're handled and what the hospital does and once you know what kind of complaints they're dealing with and the numbers, you sort of have a whole new respect for how all these things are managed. So at this stage, we all feel free to express our opinions, make suggestions, ask questions, report issues, and join in discussions. So now we really feel that we are respected team members and that our opinions really are valued.
Wonderful. Thank you, Jarina. So I know we're running out of time, so I'm just going to end on this last one here, where I think we're all going to kind of take just a minute or two just to talk about the things that, if we were to turn around tomorrow and say, hey, as the dedicated person, as the consumer, as the senior leader, what can we suggest? These are the things we're still trying to do, but what could others do? So I might hand over to Lance to begin with, just to share his thoughts.
Okay. First, invest. Invest emotionally. This has got to matter to your executive group. You've got to invest intellectually. How are we going to do this? Culture doesn't just happen. You have to seek to influence. What are you going to do that's going to change the way people think now and in 5 years' time? Got to invest in people, got to hire the right people, got to be prepared to say to clinical staff, no, I'm not going to put that money into a nursing position, I'm going to put this into this other position because it will ultimately be greater value. And I guess the other thing is you've got to be in that for the long game. 2.5 years I think we've been going now, and we're sort of somewhat along the pathway. I don't think you can buy in a solution. I don't really believe that personally. I think you have to come up with a bespoke solution for the organisation you're in. I don't think you can buy a product off the shelf that will transform your organisation, because the transformation has to come from the bottom up.
Wonderful. Thanks, Lance. And Jarina, do you want to share your last thoughts on what people can do?
Yeah, if we're looking at what we need now from health professionals, that's sort of where I'm aiming. So, a staff member once said to me, because I was trying to get change, we are the professionals. And so I thought, well, hello, I actually had quite a good professional background myself in my past life, so nobody ever checked up to see what I ever did. But so what I would like all health professionals to recognise is that every patient they see is in fact, or was, a professional in their own chosen field. And once that can be appreciated by the professionals in the medical field, they just have this vast, unlimited source of information, intelligence and experience that they can actually draw on and learn from, which would be great. One other message for all our health professionals is you must realise that one day you will be the patient. So, what do you want your health service to look like when that time comes? Because it will come. And what kind of treatment do you want? Because if you start now working towards that vision of your ideal treatment, by the time you need it, you will have the best ever treatment in the best health facility in the world. Thank you.
Wonderful. Thank you, Jareen. Thank you. And just to finish, I was just going to say one thing. I've got this little thing up here that says yes. If you're a health person, a Queensland health worker, and someone comes to you and says, hey, we want to get a consumer involved, just say yes. Just let it happen. Deal with it, work with it. And if you're a consumer and you're wondering about doing it, or someone comes to you and says, hey, would you like to get involved? And you think, that's scary, that's big, I'm not sure if I can, just say yes. Just jump in and do it. A lot of it, is just learning along the way. So that brings me to the end. Thank you. Is there any questions?
So I think that was the most powerful presentation, and it was right on message in terms of power and passion and cultural change. This is the direction we really want to go. And we had the power presenter, we had the thriver, and we had to tell it as it is. Doctor. So thank you very much. And there's certainly a facility that I wouldn't mind seeking treatment in. There's a question at the back.
You could be able to hear me. I just noticed you mentioned CAPS on one of the slides.
Yes.
Did you do CAPS training? I think you did. Did you have any consumers attend the CAPS training?
I think we did have some consumers. We put the entire workforce through CAPS. That was one of the initiatives. So Communication and Patient Safety. It's a program that's come out of Metro South. If you have a chance to do it, 100%, you should do it. It's an 8-hour program. We put almost 1,200 staff through it, I think, and it's just around, fundamentals of communication and things. But we noticed for the first time ever that after, several months of staff having done CAPS, that we actually, for a couple of months, communication wasn't one of our top complaint within the hospital. So, things go around, but it was phenomenal. Have you done it?
Yeah, I did it. As a trial, a few weeks ago. I was wondering if consumers do it.
Yeah, so I think the timing was just off for that. So we've actually worked through CAPS, because CAPS was brilliant, but it's a one-day program, and once it's done, it's done. And so we worked with the developers of CAPS, and we've developed CRASH, which is communication, respect, accountability equals safe healthcare, and that's now a 4-hour program that's part of orientation, and our consumers will absolutely be doing that. So yeah, thank you. When it is about educating our consumers, so they're hearing the same thing that our staff are hearing. Yeah.
Thanks, Suzanne. There's we've got time for one more question. We're running a little bit behind time.
Where's the question? Actually, it's not a question, it's advocacy. As a frontline worker, we are trying as well to improve the hospital health system. We are abroad also, and as a consumer, I am a witness to that. Thank you. So your voice has been heard.
Thank you.
Perhaps just a further sign of appreciation for a very, very positive presentation. Thank you again.